People, namaste, welcome back to my channel. In this video I will discuss about the civil negligence and criminal negligence. Previously I discussed about the what is professional negligence, what are the four D's, like ingredients of medical negligence. Now I will discuss about the civil cases and criminal negligences. Civil means simply lack of skill. I will explain in this. Civil negligence, criminal negligence. Civil negligence means definition means simply because of lack of skill or care leading to damage. Because of there is a lack of skill and care leading to this damage. Criminal means they are grossly or willfully done illegally. They will done the damage to the patient. Examples comes under civil negligence is wrong dose prescribed by the doctor or any wrong prescription. But here surgery on the wrong side and criminal abortions comes under the criminal negligence. Case filed in civil court, here criminal court. Punishment is money compensation. Money compensation along with imprisonment. Parties means doctor versus patient versus doctor, here prosecutor versus doctor. And evidence is proper. If there is any evidence, a probability of chances of evidence will be there, but here no evidence. If evidence, we cannot consider it as an evidence because he willfully, we can no the when the right we should surgery on right side, but he is done on left side. What is that? There is no evidence. Beyond reasonable doubt, no evidence should be taken. Burden of proof fall on the accused, fall on prosecution means like court or any lawyer fall on that persons, fall on accused. Okay. Sections are there: 336 IPC, 337, 38, 304A. 336 IPC is negligence of act that endangers the life of patient. Because of negligence of doctor that endangers the life of patients comes under 336. 337 means negligence leads to hurt. Some because of negligence, it leads to hurt, any hurt or suffer to the patient, not endanger to the life. Endanger comes under the 336. Simply some hurt, anything will be there. 337 comes. 338, if any grievous hurt, general hurt, grievous hurt 338. 304A, this is imposed negligence act of death. It leads to death. Punishment 2 years of imprisonment, fine without consent and equal to assault. He has a punishment, it comes to the equal to assault. If death of the patient comes, it is a 304A IPC. This is important. 304A IPC is important one because it considers a death of the patient. So I discussed about the civil negligence and criminal negligence. Okay, now I will discuss about the contributory negligence. Contributory means doctor has if committed negligence, but patient has contributed to damages. Sometimes because of patient it leads to like miscommunication between the doctor and the patient. It leads to damage to the patient because patient tell false information to the patient, to the doctor, sorry. Incorrect history provided by the patient telling the incorrect history, it leads to damage to the patient because of doctor. Improper follow up by the patient, follow up will not done by the patient, it leads to damage to the patient. So the burden of proof lies on the doctor, applies, or it is also comes to under the civil cases only. If it proves leads to decrease, the fine will be decreased. Generally the contributory negligence is proved in the court, like civil court, then it leads to decrease the fine, decrease the imposed fine. Next, doctrine of res ispa loquitur. This is one of the short answer question. What is res ispa loquitur? Means res ispa loquitur, patient need not to prove negligence whether the thing or fact speech for itself, because it is the patient does not speak to prove, to need to prove, because it is clearly visible the doctor done wrong. Though it comes under res ispa loquitur means patient does not need to prove, need not prove the negligence of the thing or fact speech for itself. Negligence of physician is proved by the court only with expert physician advisors only. By asking the other physicians, we can come to the conclusion that this doctor done a surgery in a very wrong way, like that we are prove in the court. with the help of the other expert physicians. Next, conditions to be satisfied. In which conditions, doctor and responsible occasion, the patient need not prove, speak, or fact for itself. In the absence of negligence, the injury would not be occur. If negligence is not there, the injury would not be occur. So, because of the negligence, the injuries occur. The doctor have punishment. If the doctor control the or injury producing treatment and instrument, the doctor know about the injury producing the treatment and what he is using instruments, all this should be doctor should know. The patient was not guilty of contributory negligence. The patient contributory means I discussed previously is giving false information, improper follow up. So there is no false information, there is no improper follow up. All these are going correct in a way, but the doctor done wrong. So it comes under responsible locature. Example like prescription war doses. The doctor prescribing war doses negligence, like if tetanus patient come give the anti tetanus, if it not given comes under the damage to the patient. Hot bottles, because of hot bottles, it leads to burns, and needles break. In doing the operation, swab should be removed. He is not collecting, it leads to damage to patient. Blood transfusion care should be taken. If he is not care, it comes to damage to patient. Prolonged splint, because of prolonged splint, it leads to damage of patient. Calculated risk, this law is not applicable even though the care is taken of injury. If so much care is taken, the injury will happen, same injury will be happen, but it comes under the calculated risk. Then it can't even though care is taken, the injury is occurred. So in this video I discussed about the civil and criminal negligence. First I discussed about the civil means simple care because of lack of care or skill. Here willfully they done the wrong. Illegally they done wrong things. Comes under here examples like wrong dose, wrong prescription. Here surgery. Here civil cause, criminal cause. Next I discussed about the punishment, parties, and evidence, burden of proof. All this I discussed. 336, 337. 36 means endanger of the life. 337 means hurt. 338 means grievous hurt. This is important. 304A means it leads to death of the patient. Contributory negligence. Contributory negligence means because of patient misinformation, improper information, improper follow up date, it leads to damage to patient. It comes under contributory. It is to civil cases. By doing this contributory evidence in the court, it leads to decrease the fine, compensation, imposed fine. Next, doctrine. I discussed the doctrine of responsible locature. Responsible locature means the patient need not to prove negligence because it easily think a fact speech for itself. Where the thing or fact speech for itself. This is important. We should write. Patient need not prove negligence by the doctor, where the thing or fact speech for itself only. By saying them, damage speak itself, no need to prove. So negligence is proved by the other physicians. Conditions means because of he neglected, the patient has damage. There is no contributory negligence. The doctor should take care of instruments, medicines, prescribing medicines for the injury. If the overdosing and it does not give the anti-tetanus by using hot bottles on burns, and I discuss like needle breaks. He does not to change the needles in operation. He should collect the swab is not collected by them. Blood transfusion care is not taken. Prolonged splint, all this comes under the damage to the patient. So this is the responsible locature is one of the short answer question also. Okay, I will discuss another important question from medical law. Thank you. Please subscribe my channel. Please support us. Thank you.